this point do not exist to show that chloroquine or hydroxychloroquine or some of the other antivirals that have been effective against Ebola, that they are necessarily would be effective against the mutated coronavirus, COVID-19. In fact, we have reason for concern that those drugs might not work as well, or they could create what's called a cytokine storm. And in people who are already compromised by the coronavirus, they may also have underlying cardiac issues, because we are seeing more and more of that show up as well. So I think we need to be a little less enthusiastic about the drug option. And I'm very encouraged that the Shanghai Medical Society has actually recently made a recommendation about something that appears to work with a significant number of people in Wuhan. And I'm referring to the use of vitamin C prophylactically to be taken as a drug, but also apparently it's being used intravenously, and it is recommended now by the Shanghai Medical Society for the treatment of cases that are hospitalized. That is intravenous vitamin C. I know that there's quite a bit of it manufactured in China, and there have been a number of studies showing that it's, number one, that it can be safe, which is important. Those studies have been done across the board, often with cancer patients, by the way, who have used it in combination with chemotherapy drugs. And there have been a number of studies now. I think the most remarkable one is, to be quite frank, is an anecdote. It's not a study, but I want to share it with you if I may. There was a family of 5 adults in Wuhan. The oldest member of that family became quite ill. She, in fact, developed the virus. All the members of that family every day took vitamin C, between 3 to 6 grams, as much as you can take without having upset stomach. The woman who was elderly was hospitalized with coronavirus. She went into the ICU, and as you know, more than half of those who go into the ICU that are elderly do not come out. The family insisted that she be given intravenous vitamin C while she was in the ICU. None of the family members, not a single one, developed the virus, although they were all taking care of this sick woman, and she recovered. Now, that's an anecdote. It's not the data that we need. However, when you tie that to other studies that have been done, and there have been some studies done on vitamin C, it's now, I think, very important for China, but also for the rest of the world to understand that vitamin C may turn out to be a very promising therapy, a therapy for people who are sick, and more importantly, can be used as a preventive agent, I think, for the rest of us.
Well, so Deborah, unfortunately, we'll run out of time, but thank you so much, and it's always good to end on a positive note. So you've given us a little something positive, which is not a lot of it out there right now. Thank you very much.